Good afternoon, everyone. Welcome to our second Veteran Access Forum. So glad to have everyone here. My name is Dr. Kendra Lee, and I'm the Associate Director for Access here at the Atlanta VA. Since the last time we had an opportunity to meet with you guys, we have made some major changes in the Access team. One of the first things that we started to do and that we came up with was a mission and vision statement specifically for our action team. We felt like this was important to ensure that our veterans, we have a way to communicate to our veterans what we aspire to and what we're working towards. And so our mission statement is to deliver seamless, world-class coordinated access to care to veterans by aligning people, process, and technology. And you may ask, what does that mean? It means utilizing our resources to improve access to our veterans across the Atlanta region. So that is our mission, and that's what we're working towards as it relates to our care for veterans. Our vision is to lead the nation in innovative, data-informed access, healthcare delivery by optimizing group practice management, advancing community care integration, and strengthening health administrative operations across all sites. So again, reiterating, our vision is to bring all of our service lines together to ensure that we're providing our veterans with the best that we have and being innovative in those efforts going forward. So that's our commitment to our veterans as a team. So today's agenda, she's going to speak to community care initiatives and things going on with our community care. Mr. Dumas is here for HAS, our Health Administrative Service. We have Ms. Knox is here for our group practice managers to give some updates on how we're doing with those in that area. And Mr. Miller is here to talk about changes with our East and West region sites, our outlying sites of care. And then we'll have questions at the end. First and foremost, I wanted to talk about some new initiatives that we have. As it relates to communications, we're looking to improve our phone lines and our websites. So we know that these are definitely areas where we have room for improvement. And so our HAS team and our operators are working together to send a message out to all of our service lines to make sure that we get updated information on what numbers to call and how to address, how to reach out to the various service lines. So we're going to do a phone line review, and that'll help make sure that we have the most up-to-date information to share with our veterans and with our stakeholders. We have a non-VA hospital emergency 72-hour notification of information. We're sharing that throughout the hospital as well as our outlying sites of care. So you will see a one-pager, maybe in the elevator, maybe in the hallway, that talks about how to reach out to the VA if you have to go to the emergency room and you need to call them within 72 hours to ensure that those bills are paid on your behalf from the VA. So please look out for that. If you don't have that information, let us know and we'll make sure we get that to you. But you should see that throughout the different facilities. We're working to develop business cards for our MSAs so that if you come into one of our outlying sites of care and you meet with the MSA and they're working with you and you have additional questions, they can provide you a business card with their extension on how you can call them back directly to get any additional questions answered, and they can follow up with you with that. We're also still working on our website. So our website will have information regarding access. So the information that we're sharing with you here, you'll be able to get some of that information on our website. We will have information regarding our shuttle schedules, or at least how to get that information that's on the website already. And then we will have a site that we will link you to our YouTube site, so you'll have access to these very meetings, so that if you missed a meeting or want to rehear something or go back to something, you'll have access to do that. The other thing I wanted to share is that the VA is hiring. Now, there may be a lot of rules and a lot of changes in how we're hiring, but we are hiring. So as of now, we have hired 38 employees within the Health Administrative Service, 4 in community care, and we've also hired on a GPM. What does that mean for you? It means that we're bringing in more staff to make sure that we're addressing your needs and trying to address them more timely. So please bear with us. We are still doing training with a lot of the staff and getting them acclimated, but as hopefully over time you will see the benefits and the more timeliness in addressing your concerns because we're having more staff being brought on board. And last but not least, I wanted to let you all know in advance when our next forums are. We've already got them scheduled out to October of next year. So the next planned meeting is January 29th. And we will have all of these scheduled. They will be here on site at the main campus in our chapel, in our gathering space. And so please make sure you come out, tell a friend, because we want to make sure we're providing you with information on what's going on within the Access arena. And I think that's all from me. Over to community care. So is Ms. Burton? Sorry, come on, Ms. Burton.
Good afternoon, everyone. My name is Treasure Burton. I am the AMSA trainer for community care, and I'll be presenting on behalf of our chief of nursing, which is Dr. Hollis for community care. So the best way to contact community care would be to use secure messaging. We answer our secure messages within 3 days, so we advise everyone to use secure messaging. You would have 3 options in there. You can ask Atlanta Community Care a question _admin, or if it's a dental question, then you would use the dental option, and if it's a billing question, then definitely use the billing drop down. And then, of course, in secure messaging, please ensure that you indicate which console you're referring to and your request. So if you are inquiring about a bill you have received, please upload the bill and send it to us in a secure message. When you let us know at least what console that you're looking for, then we can go ahead and get that addressed quickly and not have to have any delays, and we can communicate back and forth with you all that way. So that makes it a little more easier for us to respond and get you scheduled in a timely manner. So for any bills for community care billing, the Atlanta VA does pay the medical bills for community care. Optum is the insurance provider that pays all claims to the vendors in the community. So if a vendor outreaches the veteran regarding bills not being paid, please do not own the responsibility and tell the vendor to reach out to Optum. So if any vendors are having any billing issues, you advise them to reach out to Optum in regards to those billing issues. Hey, and many times it is the way they are submitting the claims when they're submitting the claims, and oftentimes we can just go back and address those issues. So it's more than likely it's just how they're submitting it, and that can be resolved with a simple conversation. So if they could just reach out to Optum for those concerns, they can get them addressed in a timely manner. And do not pay the bill or copay, because Optum will take care of that. Just reach out if you have any questions, comments, or any concerns. We can definitely assist. For bills and non-covered services, copays and balance billing, community care providers are not authorized to charge copays, cancellation fees, no-show fees, from fees, or to balance bill veterans. So in other words, community care, our authorizations do cover the billings. If you have any issues in regards to bills, definitely reach out and we can take care of those. However, any ancillary service, such as DMV, FMLA, work/duty, jury duty, excuse letters are not covered under the CCN program, so those will have to be addressed with your primary care physician. These letters are not considered medical documentation, so they would not be coming back to community care, so they would go to a primary care physician. And if a veteran elects to receive or assume the cost for non-covered community care from a non-covered service from a community provider, the veteran is financially responsible for the non-covered service. That's it. Please reach out to us if you have any questions. Thank you.
Good afternoon. My name is James Dumas. I'm the Chief of Health Administration Service. Today, I'm going to actually just go over a couple of quick topics here. First, we're going to discuss the new shuttle times for Arcadia, request a ride, VA travel reimbursement process time. We're going to talk about how to schedule your VA appointment, transportation update for Pike County veterans, also no-show rates. Here you see this slide where we have the transportation shuttle schedule from Clairmont VAMC to AVC VAMC, as well as Fort Mac. Now, this listing here is several different times. However, you want a copy of the list, you can actually stop by the transportation office, which is located over near the pharmacy. Next slide. All right, how to request a ride. If you need transportation to schedule your medical appointment, please contact transportation at one of the transportation numbers via phone. There are several different extensions, but to get to those extensions, you would dial the main number to the hospital, 404-321-6111. And there are several extensions. I'll just go over a couple of them. Extension 128046, 124525, and 124527. If you're needing to schedule an appointment, ensure that you schedule your appointment 1 week prior to your appointment time. And remember that the transportation office is closed on all federal holidays, Saturdays, and Sundays. How to request a ride? In person. If you're here at the main hospital at the VTS desk on the main floor, which is in front, again, of the oncology right down the hall from the pharmacy, that is where you can schedule your appointment. All right? Secure messaging. All right, you can sign in with a valid account, with a verified account. All right, you would need to sign in with an identity verified account through one of our account providers, which we have a couple of them there. One of them is actually signing in through your va.gov account or your ID.me account. Please allow talking about the travel reimbursement wait time, which is one of the big questions often asked. So please allow 5 business days for travel reimbursement. Veterans and caregivers can submit the claims 24/7, 365 days a year, and you can track it through their claims electronically. All right, next slide. How to schedule your VA appointment. All right. You can schedule your VA appointment by using the VA online scheduling system, request through secure messaging. However, the most preferred way is at the front desk when you check out for your appointment, stop at that time to schedule your next appointment. All right, specialty clinic. Again, same thing, the front desk at the checkout time, stop by there to go ahead and schedule your next appointment before leaving the clinic. And also the providers through entering consults or return to clinic orders. This is an important announcement. The transportation update for Pike County veterans. We're currently experiencing an issue with the Uber rideshare app finding drivers to accept or return rides from Pike County area for those veterans in that area and their appointments. We're actively working with management on resolutions to assist in providing transportation for special mode eligible veterans. Also, eligible veterans have the option to apply for travel reimbursement for their scheduled medical appointments. This is one of the things that a lot of the veterans have been missing out on. And again, I will repeat that. Eligible veterans have the opportunity to apply for travel reimbursement for their scheduled medical appointments. Scheduled medical appointments, the key there. All right, and thank you for understanding as we work to resolve those issues in Pike County. The patient no-show rate, I will just very briefly touch this, which is right now the patient no-show rate is 15%, which is 5% over the national standards. However, I think Ms. Knox, who will be following me, will go into the no-show rate for our veterans a little bit more in detail. So veterans, help us help you. Show up for your appointments. If you're not going to show up, use one of the telephone numbers that has been provided to call to make the changes for your appointment versus being a no-show. And at this time, I'm going to turn it over to Ms. Knox, GPM.
Good afternoon. I'm LaWanda Knox, the Associate Group Practice Manager. And in our section, we measure some of the measures to improve access to care for our veterans are reducing wait times. We assist with reducing wait times by maximizing time in the provider's clinic grid for direct patient care. We also offer earlier appointments to our veterans that are scheduled for future appointments. We work with the labor mapping, which we, look at the provider's non-clinical times, such as research, administration, and education time outside of, the clinical services that they're providing. We also look at their bookability and ensure that the compliance with bookability is meeting the 80% bookability standard. We work with the clinic profile managers as well as the providers to ensure that the availability of slots for patient care are there, and to get the veterans scheduled for their appointments. And we also track consult timeliness and look at the trending through each phase of the scheduling process. And as Mr. Dumas mentioned before he took his seat, the no-show rate. So the no-show rate to ensure veterans are seen when they want to be seen and or in a timely manner. We ask that if you are unable to make your appointment, please contact the clinic to cancel the appointment prior to the appointment day or time. And a few ways that you can do that are by telephone, vet text, and secure messaging. And Mr. Miller?
Good afternoon. My name is Samuel Miller. I am the East Regional Manager for the outlying sites of care for the East. Myself and Mr. Rutledge, we are responsible for the administrative oversight and operations support. And I'll also be briefing the West as well. That's Mr. Gary Bruton, my other counterpart. He does the same thing as well. We work very well as a team. With my staff, Mr. Davis is stationed down at the Pike Clinic, and my office is located at Fort McPherson and Arcadia over Atlanta VA Clinic. So some of the things we're trying to do now for these outlying sites of care is basically we just took over the leasing for the contracts for the lease sites, and so we're getting together with the lessors and fixing some of the things that we've noticed that kind of went, on the side that we need to really look at to take care and ensure that we are making sure our veterans and our employees have a nice place to work. And so we'll be working with the lessors and things of that nature. Fort McPherson, if you've been there lately, we just got a new parking lot, just repaved in the last couple of months. So we're doing a lot of things at Fort McPherson as well. Some of the things we're doing, working on fire alarm system right now down at the Dom, and also trying to get our chillers back online. So all those things will be working for the upcoming winter months. For my West, Mr. Bruton, he sits at Trinkle Davis, and Mr. Derek Jones is his other site managers at the New Cobb County Clinic in Marietta. I know that he and I talked about Trinkle Davis actually getting ready to get a 12-bed CLC built. Not sure exactly when that construction will start, but however, that's going to really help our veterans, give them extra space out there so we can, continue to take care of our veterans out at Trinkle Davis. I know that at Cobb, we're still working on contracting for the SPS system so that we will be able to have our RMD cleaning and such. I know that contract is still getting in the reward process, and we'll keep everybody posted on that as well.
Well, that is our presentation for today. I want to say thank you for those that are attended online and for everyone that's here in the room. We appreciate your time today, and we look forward to increasing the amount of people that we have, but also making sure that we're getting updated information out to our veterans about access. So again, our next meeting, our next forum is going to be January 29th at 1 o'clock or 1:30? Okay, at the gathering place. So we'll make sure that the information is sent out and shared with everyone. And then we will start marketing a lot earlier. But again, thank you so much for your time. Happy holidays. We look forward to seeing you in the new year. But if you have any questions, please reach out. We did provide information on how to reach us, phone numbers and email addresses. So reach out as often as you want and as soon as you want. So thank you so much.